You know, for all of our conversations about COVID's impacts, we so rarely talk about how it can impact somebody's mental health, even long after other symptoms have passed. Our Nusha Roy takes a closer look.
After quietly suffering alone, a viewer wrote in. She had COVID around a month ago and then noticed that she started having anxiety to the point that it's affecting her life day to day. She says it took time for her to connect the dots between the time she got sick and then when she noticed changes in her mental health. She can only imagine other COVID survivors are going through the same thing.
Yeah, I think it's pretty common.
Dr. Justin Ross with UC Health said anxiety post-COVID makes a lot of sense.
And so from a psychological development area, it makes sense that following contracting the virus, people would be struggling with all the elements that propped up anxiety.
The pandemic is ripe with uncertainty, feeling a lack of control and threats to our health. And while COVID has been heavily studied, there is a lot left to be explored, and its impacts on mental health is one of those areas.
A question that we'll need to continue to pay attention to.
At the same time, so many people developed anxiety, depression, and PTSD. It's listed as a long-term COVID symptom, along with headaches, shortness of breath, and neurological symptoms like memory loss and brain fog.
If we assume that COVID is going to play out very similarly to other stressors, people who've experienced COVID, be it being ill, someone they love being ill, or just living in society.
I'm a big believer. I often talk about mental health concerns are not mental health concerns. They're really common human experiences that occur because you're deeply human.
So that last point is one that I've been thinking about a lot all day, because the person who did reach out to us was worried about going on camera because of stigma and how that might play out at work, but at the same time feels like no one is talking about this stuff, which can be very, very isolating. So mental health advocates said the same thing, and they hope that by opening up the conversation, maybe employers can be a little bit more flexible, and then maybe more people will be comfortable with reaching out for help.
And it can be so discouraging, Anusha, if somebody turns somewhere for help, gets a no, or gets turned sideways and then just might give up entirely, you know?
Yeah, so the woman who reached out said that she reached out to her primary care doctor, and then the doctor didn't have an appointment for months and she needed help right away. And she's kind of just been stuck ever since, just spinning her wheels trying to find some help. So the advice today was reach out to the mental health centers directly, the therapist directly. Of course, check insurance and out-of-pocket costs. But Kyle, what has popped up recently with the pandemic is actually online platforms to connect with therapists. This is in-state, out-of-state, and it's just another way that people can kind of open the door to get some help.
Yeah, to have that conversation. Anusha, thank you.